Menopause is a universal experience of midlife women. Majority of women experiencing the menopause transition experience symptoms due to the hormone changes of menopause. I'm Ekta Kapoor. I'm an endocrinologist at Mayo Clinic in Rochester. I'm also the assistant director for the Mayo Clinic Center for Women's Health. And I'm here today to tell you about our article that is scheduled to appear in the November issue of Mayo Clinic Proceedings. It is entitled Addressing Menopause Symptoms, Barriers, and Opportunities for Improvement. The key takeaway from this article is that menopause symptoms are common. They can significantly impact the quality of life for midlife women. Despite that, these symptoms are under-recognized and undertreated. Majority of women are not seeking care for their menopause-related symptoms. Therefore, there is a need to find solutions, potentially using digital media and artificial intelligence to proactively identify these women who are experiencing bothersome menopause-related symptoms and educate them and their healthcare professionals about the importance of treating these symptoms, and also to educate women and their healthcare professionals about the safe and effective treatment options that are currently available to treat menopause-related symptoms. A little more than 1/3 of women experience quite bothersome symptoms that have the potential to impact their quality of life and work productivity. Despite that, it is well known that menopause symptoms are under-recognized and undertreated. So the goal of our study was to identify the barriers among midlife women who receive primary care at Mayo Clinic, the barriers that keep them from seeking and receiving treatment. So we conducted a cross-sectional study among midlife women between the ages of 45 to 60 years. These were women who were receiving primary care at 4 Mayo Clinic sites. We sent out a questionnaire to these women asking them about their menopause experience. We specifically asked them about the common menopause symptoms and the degree of bother due to those symptoms. We asked them how these symptoms were impacting their personal and professional lives. And most importantly, we queried these women whether or not they were on treatment for these symptoms. And if they were not on treatment, then we asked them about the reasons for not seeking or receiving treatment. So we sent out over 32,000 surveys and received nearly 5,000 responses. More than 1/3 of our participants, as expected, were experiencing moderate, severe, or very severe menopause-related symptoms. The most common symptoms reported in our study included sleep disturbances and weight gain. And now here is the interesting and the disappointing part. More than 80% of the participants in our study were not on treatment for their menopause-related symptoms. Many of them chose to manage their symptoms naturally. Many women reported not having the time to get evaluation for menopause-related symptoms. A fair proportion of them also reported not having the knowledge regarding safe and effective treatment options for menopause-related symptoms. At the end, a little over 1/4 only of our participants were on specific treatment for menopause-related symptoms. Now, given how common menopause symptoms are and the extent to which they can impact the quality of life of women and their work productivity, the fact that majority are not on treatment for symptoms is rather mind-boggling. So what this study told us was that there is a tremendous need for developing creative solutions to this problem, getting innovative about ways to identify women who are experiencing bothersome menopause-related symptoms and determining ways of educating these women and their healthcare professionals about treatment options. So my colleagues and I at the Center for Women's Health are doing exactly that. We are developing algorithms and digital solutions proactively identifying women with bothersome menopause-related symptoms. So they are educated and informed about their symptoms and potential treatment options so they can present to their healthcare professionals empowered and educated to have a focused and informed discussion about their treatment options. So I'm really hoping that you will take the time to read our article in the November issue of Mayo Clinic Proceedings. Thank you.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.